So, week 4, we're like 1/3 of the way through already. First exam. Again, next week is going to be reviews again, and then there's exam again on week 6. Now, this exam will be posted about 12:30 on Saturday. Your grades will be posted there. What we do is we get together, all of the pediatric professors teaching this course, and we look at questions and we make sure that they were fair and that you had a good opportunity to get the correct answer. If we're finding you're not, we will, throw questions out, and we will do that because our goal is to be fair as possible for you. So that will be happening on Saturday. You'll be getting your grades. Now, anybody less than a 78, please make an appointment with me. I want to go over it with you. I'm going to go over it and look and see if you were not doing well on the dosage count. I'll be sending you a video and some worksheets to start with, and then please meet with me. I want no questions on math wrong. It's 10 points every exam that should be just given to you, okay? So if I'm seeing 2 or more, I'm going to get a hold of you and I want to work with you, okay? And I can work on your time frames. So this week, it's chapter 21. It's all about a child's experience in the hospital. So I'm going to do that by giving you a Kahoots. And, I've gone over it, I've looked at it, questions, looking at the PowerPoint, looking at this. And I really firmly believe that this Kahoots goes over all your concepts you need. Although, you do have the PowerPoint that you've already gotten. So let's go ahead and share. Does anybody want to win today? I know you're all about brain dead after an exam. I understand that.
Professor, how
Yes,
are you? I have a question.
sure.
Um, Professor, is protrusion and etrusion or something like that the same thing? Like almost the same?
Extrusion is
Extrusion.
this one. When
Protrusion
you
of the
put
tongue.
food in
Right.
their mouth.
Okay. Okay. I just want to make sure
The
because I
babies.
saw both of them and they were kind of correlating, and I want to make sure I, chose the correct answer. Okay.
I understand. I understand, Angela. Not a problem. I knew somebody'd have a question. I always expect one. Anybody else want to come in and play today?
One moment, I'm coming. What
Okay. Well, I know you do. You'd like to win.
is that? What? Yeah.
All right. There
Um,
you go.
um,
So here we go. Week 4. Only chapter 21 that we're looking at right now. So, which child would have the most difficulty in coping with separation from the parents? One of the biggest stress of the toddlers and preschoolers is when mommy has to leave. That's that separation anxiety that you're doing a discussion question about. So, but what is the most difficult in coping with that separation? Who is that child? Well, it's the toddler. Preschoolers tend to deal with stress better, right? But that toddler is no, once mom is going to go through all those 3 stages, he's going to go through, that crying and screaming and then the regression and then like, I don't care if you're here, mom, because I don't want to get bonded again because you're going to leave me again. So it's a toddler. How can we decrease the stress and anxiety of a 2-year-old that's hospitalized? Well, how do you think? Remember, toddlers, what do they like? What keeps them, feeling comfortable? And that's knowing what's coming next. And that is your schedule. That's your routine. The same thing at home. It could be the same foods if the diet allows it to be. It could be bath time the same time. All of those things for a toddler, which is that 2-year-old, is very important. Dramatic play has the child draw a picture about scary hospital procedures. Why? Why do you do that? I mean, if you think about hospitals, I mean, we are the most scariest people. I mean, every time they usually see us coming up to this point is we're giving them injections all the time, needles, needles, needles. So that dramatic play allows a way for them to express their feelings. And it shows us sometimes a child, even younger kids, they can't express exactly what it was, but they have an idea and a picture in their head. So it helps us stop that and eliminate that fear. So a 2-year-old's been crying constantly for his mother since he was hospitalized 3 days ago. This behavior is what? You know, this child absolutely feels like they're abandoned by the mother, the parents. And you know what happens? They cry and they scream and go bonkers initially. And then all of a sudden they start sucking their thumb again or want a pacifier or they're incontinent when they're potty trained. It's they regress because they're angry, they're upset, and then they regress. And then they're like, okay, you're gone. It's all right. So there's 3 stages of that separation
I have
anxiety.
a question about that one.
Okay, hold on a second. Which statement best corresponds to the preschooler's understanding of hospitalization? The preschoolers, what do they think? How do they think? So this is all about I did something wrong, I'm being punished. And this can go on into the early school age area too. Yes, you had a question. Go ahead.
Would that behavior of like the feeling of abandonment for a 2 year old be different if that child were like in daycare or something since they were really young and they're used to mom or dad going away for a while?
It could be different, but remember they're sick. Children, when they're admitted to a hospital, they're sick. And when they're sick, who do they want? No matter daycare or not, they want mommy and daddy. But yes, you're absolutely right. It can decrease the amount of screaming and crying because they're used to being dropped off because that's been it. That's a very good point. I never even thought of that. But so understanding hospitalizations, remember young children think that they get sick, break a leg, whatever, because they hit the sister or whatever. They've done something wrong. So the toddler seems more interested in her toys than the parents. Which stage of separation anxiety is this? Remember, there's 3 stages. Which part of it is it? This is the third stage. This is when they've cried, they've regressed, and now they're like, all right, they're not here, and I'm not going to look. And the reason why they do that is because if they attach again to the mother, they know it's going to leave again. Mother, father, caregiver, whoever it is, they feel they're going to go again. So that's why that's denial. They deny that they're there. Which roommate would be the most appropriate for a 16-year-old adolescent with cystic fibrosis? Now, in the hospital, multiple times, there's 2 beds in a room, sometimes 4. And you need to determine what would be good choices. You don't put dirty patients with clean patients, as we say, or immunosuppressed children with children that have some sort of infection. That's what this question's about. So, cystic fibrosis, they've got the lungs that have a petri dish and they get germs in there and they get sick quick, right? A diabetes mellitus, they are clean. They have no disease. That is the perfect one, and that is why. They don't have to be in a private room. And we know that adolescents like to have somebody around their own age. They can talk about what's going on, talk about the nurses behind their backs, right? So parents of a hospitalized 9-month-old infant ask if their preschool child may visit his younger sibling. So you have a baby in a hospital. They don't really know that sibling is gone, but the sibling at home's worried. Sometimes it's a girl and that's their little baby, right? And their brothers, they want their play partner. So the thing about preschool children coming to see is they need to see them. We're lucky today with FaceTime, but FaceTime isn't touching and feeling that child. Now, when there's other things we can have that preschooler send cards or pictures or toys or something to the child. But when that child goes to the hospital, make sure they're prepared for what they're going to see. Do they have IVs in? Do they have tube in? Are they monitors and beeping going on? These things we need to tell that preschool child. We don't want them to get afraid and scared by what they're seeing, okay? But it's perfect. You do need to let them see that. So a hospitalized toddler was drinking from a cup at home, but now refuses to drink anything but his favorite bottle. What's that? Toddler in the hospital and he only wants a bottle. And this is absolutely dealing with the anxiety, the hospitalization. This is that regression. And again, toddlers probably the hardest group of children in the hospital because they need mommy there. They need their routines and they will regress if they don't have that. A multi-select. A nurse encourages a school-age child to draw a picture after a painful procedure. Why? School-age children really understand what's gone on, right? And sometimes they don't like to tattle on people. So what it does, it gives them a way to express the way that they're feeling. Also, as they're drawing a picture, they're forgetting about what happened, about that pain at that time. So this is the absolute reason why we use things like play. And this is play, is drawing a picture so we know what's going on. When is the best time to begin to prepare a 5-year-old child for surgery and hospitalization? So you're 5, this is your preschool age. Remember, they're a little bit easier to deal with the stress of hospitalization than a toddler. But you need to give them a couple days to adjust. About 4 days is about all they need. I wouldn't tell them 3 weeks in advance. They're going to be worrying about it up to that. Not the night before. Those things are not good. But a couple days before, and then they could ask questions or maybe visit the hospital, and find out what's going on through the child life team. So a 13-year-old's been hospitalized for the past week. What do you think the girl's biggest concern is? So look at the age. They're 13. They're adolescents. What are adolescents all about? It's their identity, right? Versus role diffusion. But this has nothing to do with that. It's all about their identity. So her biggest concern, my hair's dirty, right? I haven't blown dry my hair. I haven't used a curling iron, a straighten iron. These things really, on adolescents, do upset them and it really concerns them. So I used to, even the children that were in the hospital in complete bed rest, I'd wash their hair for them and put it up and comb it and put ribbons in, whatever, because I knew that that would make them feel better. I can't tell you how many times I did that. The nurse notices the mother of a child with CP redoes many of the things the nurses does. What would you talk to the mother about? Like, why is she redoing all these things? So just think, a mother has a child with CP. They've been dealing with this child from birth, right? You have to think of this question in that regard. So you don't want to break that mother's routine. That mother has dealt with that child. You can see the child's well taken care of. So share with me, what are you doing? Let me help you do it those way. Or if you see something that could be improved, help the mother to understand. Don't put her down. Commend her on the great care, but hey, try it this way. It might work a little bit better. Think about it. Okay. So a toddler cries when I visit. Maybe I should just stay away, the mother says. So what's the nurse's best response? Again, this is all about separation anxiety. And again, it's the toddler. This is absolutely common. The me, mine, no, no, no. And it's, mommy's gone, and they go through all the stages of separation anxiety. Common reaction for toddlers. Preparing to collect an admission history from parents who've recently emigrated from Russia, what should you keep in mind? Now, this is all about culture. And remember, in hospitals, I used to be in a town where there was no difference or diversion. I moved to Miami and I am like overwhelmed with different cultures. And it is me as that nurse to ask those parents about things that are appropriate to their culture, okay? The Russians don't like you to smile when stuff is going on that's serious. It's just against their culture. What does that mean to them? I'm not Russian. I don't know. But it does mean that smiling you wouldn't do if you had a child who was Russian or parents that were Russian. Which nursing action would facilitate rapport with a child and the child's parents during the admission process? So you're going to be calm. You're going to answer questions in that matter of fact way. I mean, many things I would do. A child's being admitted. Wow, you've been going through this for a long time. Wow, you've got your child here. We'll take good care of them. Those things make that parent feel validated, and talking to them calmly gives them calm too. Okay. You don't want to be, oh, and really, and this happened, and oh my goodness, that would make a parent really upset because what do you mean? What are you talking about? It's my child. A 4-year-old child begins to cry when his mother tells him it's time for his operation. Which particular fear is this? Now, this is 4-year-old. This is your preschooler. What are they concerned about? What are their fears? They don't like those invasive procedure. Remember, preschooler is the age of band-aids. They get cut and they're going to bleed, their insides are come out and they're going to die. This is a preschooler. So again, they're afraid. So what would you do for that child with a surgery? Well, I'm going to tell the doctor to put a nice big band-aid on there so it'll be all better when you're done. And that pain in your tummy is going to go away, right? Little stuff like this helps these preschoolers. How does a preschooler understand the reason for being hospitalized? Again, the way that they think. What did I say about preschoolers? Hospitalized, injuries, broken arms. It's my appendix got sick because I hit my sister. I can't tell you how many children I would sit down in the ER. They're going for surgery for an appendix. And I'd say, listen, that appendix is there in your tummy. And, sometimes you don't want to be there. So it just says, hey, take me out. I said, you did nothing wrong for that to happen. That appendix decided it. You didn't do anything wrong. And I want you to know, children, especially preschoolers and young school age, you can see their arms relax and they just feel better because they feel they're going to go to surgery and die. That's absolutely what they feel. They're all about death at this age. What age child has the most difficulty with coping with separation from parents when hospitalized? You know this one. Separation anxiety. Which child's the worst? Again, it's your toddler. Infants, they really don't understand. Preschoolers tolerate better. And school age, they understand because mom would have said, I've got to go, I'll be back later, whatever. But that toddler, they don't get it. They're the one that has the most problems with it. How do you know the parent understands a hospitalized toddler's need for transitional objects? Does the parent understand that their young toddler needs transitional objects? So the stuffed animal was there, brought things from home. Maybe it is their special toy, their special blankie, special binky if they're still using their pacifier, their special sippy cup. These are things that make them feel secure. I know Christian, my grandson, he had a special blanket and he had this little beanie baby giraffe that he called Mr. Puppy. And with them, he felt comfort and he would sleep with it. Why he called it Mr. Puppy, I have no clue. To this day, I don't know. How would you tell a preschooler when daddy is coming to visit them so that they could understand? So, this is a preschooler's understanding of time. How do they understand? So it's you have to place time with an event. Has nothing to do with a clock or numbers. They just don't get it. They don't understand clocks till about 6 or 7 years old minimum. So after lunch, daddy's coming. After the nap, in the morning when you wake up, these are things that preschool understands. It's they associate time with events, not numbers on a clock. What advantage of fentanyl for an upcoming procedure will the nurse explain? What's fentanyl? It's an extremely strong opioid. It's a narcotic similar to morphine, but stronger, 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 stronger. What's the big advantage with them? And actually, I can tell you a couple. Number one, it acts quick. And the other thing, it's usually for 1 hour. So it's short acting. So you can go ahead, give them something, get a procedure, and in 1 hour, it's already wearing off. If you take a Percocet or oxycodone or one of those things, that'll be good for 4, 6, 8 hours, depending on the person, right? But fentanyl is a great, strong opioid. We use this even in the newborn intensive care unit for premature infants to keep them calm and free from pain. It's an excellent drug, very safe, and we use it on all age children. The nurse shares the information and timelines recorded on the interdisciplinary outline of care. What is this document? The interdisciplinary outline of care. What's that? It's basically what we call a clinical pathway. Now, let me put it in more perspective for you. Um, there is a child who's coming in for a tonsil and adenoidectomy as an outpatient, right? They know the nurse has these pre-printed guidelines of orders that this child's going to have, pre-op, post-op, and discharge orders. It is called a clinical pathway. In the adult world, the first one that was ever made was a myocardial infarction clinical pathway. You come into the ER complaining of chest pain, da needs to be done, and this will be done, and then you'll be put in the hospital, and these medications will be given. You know exactly what's happening because it's already written. They have already researched and know the best way to treat that thing. So it is called a clinical pathway. A multi. What is the name of an adolescent that has legal rights to sign their own consents? And also remember, any adolescent who can sign their own consent, you must ask them if the parents can be there and listen to what the doctor's saying or listening when lab results are being said. That is HIPAA. That person, emancipated minor, or that cognitively aware 18-year-old male, they have to give you the permission in order to speak in front of parents. And parents don't like that usually. And I've had to work with that situation. The nurse is preparing to start an IV on an infant admitted to the pediatric unit. What intervention is appropriate? You're starting an IV. What's appropriate? It's an infant. So always involve the parents when starting it because on an infant, here, give them the pacifier, put sugar water on it, let them suck it. The nurses will hold the arm, you hold the other hand, talk to your infant and keep them calm because the parents are key to keep that infant from being overly stressed because we have to hold that arm down and they do not like that. But with the pacifier and the mother holding the other hand, they usually do very well. A multi. What are the stages of separation anxiety? If you haven't done your discussion question yet, these are them. And don't just cut and paste this from Google or whatever. Know what the 3 stages are. You are going to see these on exams. Denial, despair, and protest. Acceptance is nothing. So 3 stages. What is that? Protest, screaming and yelling. And then despair. Oh, that regression, sucking the thumb, being incontinent when they're potty trained. And denial, mom comes, oh, they ignore them and only want to speak to the nurse or whoever. A multi. What will the nurse include when documenting the discharge of a pediatric patient? Important to understand, discharge isn't just say, hey, goodbye. There is many things that we need to do to keep the child safe, the parent understanding, and just that total documentation, which covers your butt as a nurse. So, who was the adult? How are they going home? Is it a bus or is it a private car? What's the child look like? Were written instruction given to the parents? And then something else, they understood the instructions that you gave them. They verbalized understanding. And then their time of discharge. Instructions that were given to physician, that doesn't matter, physician. It's more of, did the physician give the parent any instructions that you're unaware of? But usually it is not that.
Why is method of transportation important?
Well, do they go home by a bus? Do they go home by a taxi? It's just part of what we do right. Or it just shows the safety of the child. I know it's a weird one, but I agree with you there. A multi. What are the basic fears of a young child being hospitalized? So they're afraid of cutting you open and their bloods and the guts are coming out. Remember, young. So you would say toddler preschoolers, separation anxiety, and then pain, of course. They have no idea that this stuff costs money. Very good. Nobody picked that one. And last question, multi. What nursing care would you incorporate when caring for a toddler? I think you see hospitalization, the hardest group to deal with is those toddlers ages 1 to 3. It really is. Your next stage would be your preschoolers, and school age and adolescents tolerate it better, just giving them their space and their time. So, therapeutic care, you're flexible with these children. If they're having a moment, let them have a moment, come back later. And of course, any soothing techniques, whether it is explaining things to them, letting touch them equipment, that's not scary. I would never show them a needle or a suture, but other things that they can touch, arm boards and the tape, etc. So these do help with your toddler. Toddlers are the hardest group. Marnie, good job. Lucinda, good job, Lucinda. Number 1. Chaka, again. Good job. Kay and Amila. So, okay, we are done with this week. So just remember, your
Karen,
exams are
third
not going to be
place.
out.
Yeah,
Your
you didn't.
exam grades are not going to be out until you see them on Saturday. Anybody, I'm going to even set an announcement. Anybody who has math questions missed, I'm going to reach out to you. And then number 2, anybody 78 or less, if you got a 94, you want to know what questions you got wrong, please just reach out and I will go over them with you. I understand those too. Thank you guys. I will see you
Thank
all
you.
next week. Remember, next week is reviews again. Okay?
Okay.
I'll see
Thank
you
you.
then.
Good night.
Good night, guys.
Good night. Good night, Professor. Thank you.
Very welcome, my dear.